So against that backdrop, let's bring in an expert who we have spoken with before to continue our conversation. Tevi Troy joins us now. Tevi is the president of the American Health Policy Institute, an adjunct fellow for the Hudson Institute, and former deputy secretary for the U.S. Department of Health and Human Services. Tevi, as we welcome you in this morning, what is your reaction to the news of a doctor with Ebola in New York City?
Well, first of all, we have to be compassionate towards the doctor and appreciative that he was out there in Guinea trying to help people with this disease. I agree with Mayor de Blasio that it's only transferred through bodily fluids, but I would not agree with him when he said it's extremely difficult to contract. Obviously, we see this disease spreading widely in West Africa, and that one patient in Texas spread it to 2 people. So I'm hoping that they do the right things in New York and limit the number of people to whom Dr. Spencer spreads the disease.
So Tevi, following up with that a little bit, what we keep hearing from professionals is not to worry, it's not going to be an issue in the U.S., but that really seems to not be the case. Should we be concerned?
Well, I mean, the question is not should you be concerned, but the level of concern. So if you are watching this show right now in Nebraska or Iowa, don't think because somebody in New York has this, you're going to get this disease. But I would be very concerned about the healthcare workers in Bellevue. Bellevue is prepared, which is the hospital where he's at in New York. Bellevue is prepared to deal with this, but I would think those healthcare workers would have to work very carefully to make sure they don't contract this disease when trying to help the patient.
Tevi, according to an article of Reuters, the Ebola crisis may force some in our healthcare system to actually consider withholding care from Ebola patients because they're too dangerous to doctors and nurses and perhaps unlikely to help a patient. What implications would that have if, in fact, it happens?
Yeah, well, first of all, I would hope that no healthcare professionals or doctors or nurses refuse to treat patients, and that would be terrible. But I think that the question that Reuters is getting at is, are there certain levels of treatment that we don't want to engage in with a low probability that someone will survive and a high probability that it could expose healthcare workers to body fluid? So I refer here to the intubation of Thomas Eric Duncan at a pretty late stage in his care when I think it was pretty clear that he was not going to survive, and that exposes healthcare workers to bodily fluids. It's a paradoxical thing that our invasive and intrusive and very modern healthcare approaches here in the West, here in the U.S. in a first world system, while they are very successful at treating people, they also do expose our healthcare workers to more potential interaction with bodily fluids than you would have in a less developed healthcare environment.
Tevi, you were preceded on this program by Betsy McCoy, and she made the point, if hospitals can't even handle those hospital-borne infections that we see and are so prevalent, what makes us think they can handle something like Ebola? Your thoughts on that?
Yeah, I mean, it is true that hospital-based infections have been a problem, although we have made progress in dealing with them. I think the idea with Ebola is not that every hospital in the U.S. can deal with it, and we saw in the hospital in Dallas that there are obviously some challenges, but that we have certain hospitals that specialize in it. So in New York State, for example, there are 8 hospitals. Bellevue is one of them that is designated to deal with Ebola patients, and hopefully they have the procedures in place so they can deal with it.
Well, a lot to deal with, and I tell you what, Tevi, we're going to ask you to stay there. Morgan, when we bring Tevi back following the break, the whole specter of weaponization, the international impact of what is going on with Ebola, obviously it's a major concern, and that's why we're talking about it this morning. And we want to hear from you. You probably want to talk about Ebola in New York City. We would love to get your comments. Why don't you tweet me your comments at Newsmax TV, hashtag America's Forum. You can also check us out at newsmaxtv.com/comment. And Tevi Troy will return with us following this timeout.